Hi, I'm Patrick Fleury with bagmask.com, and I'm very fortunate today to have Dr. Brian Cohen with me. He is a co-founder of Adaptrack, which is a CME program. He's also a co-founder for Miami Anesthesia Services. And I think most importantly, he's very lucky, like myself, in that we're both girl dads. So Brian, thank you for coming on board here with us today.
Absolutely. I'm happy to be here with you, Patrick.
Excellent. So one of the things that I went through with my training, I'm sure you did too, as you got closer to start looking for a job, is you'd have that first friend or colleague who went out for a job interview, and you sort of hit them up like, hey, what was the job interview like? I've been reading a lot of stuff on job boards and just discussion boards lately, where I see these conversations continually coming up. So I thought it'd be kind of cool to talk to some different practices and find out what their interview practices are like. What type of candidates they're looking for, and what type of questions you think these candidates should be asking to make sure the group is a good match for them. But before we get into those, can you just sort of give us an idea of what your practice is like?
Sure.
Anesthesiologist, anesthetist, what type of cases you're doing, scheduling, and all that.
Sure. Yeah, so we started our company about 6 years ago, Miami Anesthesia Services, and we really range anywhere from Palm Beach down to Miami in South Florida. And I'll tell you, how we started and where we are now, and where our focus is. And we really founded our group for a specific hospital that was being built. It was a concierge surgical and OB hospital in Miami with physician ownership and very high touch approach to patient care, and very high touch approach to even physician colleagues, within the project. So that hospital allowed us to create a group. That hospital lasted about 20 months. So by the end of the 20 months, we had a group. We had about 35 employees. We were in network with all the insurance companies, and we were standing there with no job. And we said, well, what just happened and why? And the interesting part was we built a 68-bed hospital, and because we were so proactive and excited and aggressive about sort of resetting the approach to pain control and anesthesia and getting these patients to a point where they're ready to go home, same day, next day, we had no inpatients. So, what we learned was we noticed the shift that was starting to occur at that time with major surgeries, total joints, spines, all of those things that have been going on elsewhere in the country for many years. Outpatient was starting to happen in South Florida, and that we could do it. So it was really kind of this, epiphany moment where we either say that was fun and walk away, or we say, let's see what we just succeeded at and see if we can go spread that out further, and take this approach to high touch medicine in the outpatient world. And that's really where we've been now for the past, almost 5 years, 4.5 years. Really concentrating on all ASC outpatient anesthesia. And again, it all stemmed from the fact that to the benefit of us, but to the to the problem of the hospital, we really found a way to do it in a more efficient way for the patients and get them home safely. So that's where we've been having our fun for the past few years.
Well, it's pretty interesting that you took a failure and really made it to a success. And I'm kind of hoping that you don't bring that to my hospital, because I like my hospital where I'm at. And I don't want you closing that down. So let's really take this from the perspective of an anesthesiologist. Say you guys are looking to hire a new one. What is your interview process like? Give us a walkthrough of what that day would look like.
Yeah, so, we, as an outpatient group with kind of that high touch feel, before I jump to answer, exactly what it is, I'll say what's most important to us is culture. And again, that formed from day one as to why we were even forming a group, the hospital in which we were forming it for, and then carrying it along to the fact that, each outpatient center is like a mini junior high school. Like it's a gossipy place. It's a place where you spend hours with a very limited group of people. The personalities have to match. The incentives have to match. Everything really has to line up. It's much harder to lose yourself or hide certain aspects of your strengths or weaknesses as compared to a large center with 15 ORs and hundreds of different combinations of people. So I'll say that when we are going through the hiring process and looking for the right people and starting to have those conversations, that is the driving force, is what is your culture, what is your personality, and what are your goals, what are you hoping to get out of this. We found that when we focused on that, when we were starting our group, and we started it as 4 physician partners, but one of the first things we did is we started hiring what we were using in that area was CRNAs. When we were hiring our first 2 CRNAs to really spearhead our CRNA portion of our company, we wanted to find the leaders that really set the tone of the culture that were extensions of ourselves. So we interviewed 43 people before we hired our first one.
Wow.
Now that's unusual and that's extreme, and that's because we felt that we had one chance to start something. It's much easier to start a culture and to maintain that culture and level of care, as opposed to getting into something and trying to make a change. So we really put a lot of stress and focus in those first few steps and starting it the right way, what we thought was the right way. And that approach worked. And now we've never had to go through that extreme process again, because as you bring in these people that really are extensions of your own personality and drive and culture, they begin attracting others just like themselves. So if we are going to hire a physician, we are putting ads out there if needed. We are also going mostly by word of mouth. And the interesting thing in the outpatient anesthesia world, if you think about sort of, how everything in medicine sort of goes through the peaks and the valleys, for many years, you were finding that the star physicians were the ones running the show at the hospital, right? They were doing the hearts, they were doing the joints, they were doing the spines. They were the ones the surgeons always wanted in the rooms. They were hustling. They were going to conferences and learning the new techniques. And those older guys who were like on their way to retirement and kind of wanted to chill, go hang out at the surgery center. You're going to be happy. They're going to be happy. It's easy. It's relaxed. Yeah. And it was that way for a long time. And what started to happen was, as the ownership of those centers went back into the hands of the surgeons and the management companies, everyone was very focused on efficiency and profitability. And the larger type cases started moving back into the outpatient world with the total joints and the spines. You saw a little bit of a shift in that paradigm where, hey, leave the older guys who want to kind of relax over at the hospital and send me your best one over to the surgery center, because I want them hustling and doing a great job, so this patient who had a total knee can go home in 3 hours. So you sort of saw that shift. And we have to be very careful in how we approach those 2 extremes of types of people that are looking to come into the outpatient anesthesia world. So a lot of it's just conversation, and it starts out as very easy conversation. And I think for us, we are so focused on really being kind of that family-driven sense of community group. It doesn't fit for us to have a very formal interview where you're sitting there suit and tie and I'm peppering you with questions. Mm-hmm. I want to know about your family and your hobbies and really what you hope to gain. What kind of job are you looking for? And it is very conversational. Now, I will tell you that, as you can probably notice, I sometimes do a lot of the talking in the interview, whereas the interviewee is supposed to be doing a lot of the talking. But I think it's really important when we have these interviews and when we are looking to bring people into the group, they know the background of our group. And because it did start in a unique way, and it did sort of transition because of a unique scenario, and all of those factors really helped really draw out who we are now and how we like to go about business and for what reasons. My partners and I, we all spent years in larger groups, whether it was Mednax or Envision or large corporate or private groups, and we all picked up things that we didn't like about what they did or how they did it. So, I would rather be very transparent with somebody coming in and saying, look, this is how we like to do things. We're not going to give you a cookbook to do it, but I want you to know what we do and why. And for example, if there's 2 anesthesiologists at a center, we check our ego at the door and we work together as a team to make sure things get done safer, better, faster, rather than being offended if I'm trying to help you out, which oftentimes may happen in other settings. So part of my job as the interviewer is to give enough background so that they feel comfortable enough and open enough to really just give me honest opinions as to what they want. And it becomes, oftentimes that becomes a much deeper conversation because, well, what do I want out of my job? Well, sometimes that leads into conversations about family or other responsibilities. And I think those honest conversations are the most important part of the entire process. From day one, it's what really is going to determine success on both sides.
Yes, absolutely. And I really like the idea that, it's not really a formal interview, but it's more of a conversation. That's one of the things we always try to harp on in bagmask.com is that it's a two-way street, because you got to make sure it's a right fit for you also, because you don't want to get into a situation where, after the first couple of weeks, you're like, oh no, what did I get myself into? Maybe this little small family atmosphere is not what I want. So, and it's also refreshing to hear that, you really do talk about culture, because I think a lot of times when you go in for that interview with leadership, they sort of gloss over it. They might tell you a little bit about this, but they don't really harp on that. But like you said, if you are going to be working together with people all the time, you really want to make sure they understand this is what you're getting into. You're going to be part of the team. You're just not going to be some lone wolf out there where we're going to stick you in an OR for 10 hours and not hear from you again. I think that's great. Is there certain questions you found over the years that you sort of wish people would ask just so they get a little bit better understanding of the group?
Well, I think the key is just asking questions, period. I mean, just like you alluded to. It's hard being in that position of, being on that first date, which is essentially what the interview is, right? And you don't want to come across as somebody who's not a hard worker or is not a team player or all of these things. But for example, if I ask a question, hey, what are my typical hours? Well, why are you asking that? Are you not willing to work, past 3 o'clock, or are you just not, and you kind of have to get past that point to be comfortable asking the questions and maybe give reasons why, so, if I was to ask that question, say, what is a typical day like? And, I don't, for example, if I don't have responsibilities to be home at a specific time for childcare or for, something else that's going on. But just curious, what can I expect, from a Monday through Friday, from a weekend, from a day-to-day point of view? And, sometimes the best way to ask that is, so what is your typical, day like, or, and not specifically, well, how many hours am I going to be there?
Yes.
Am I ever there past 7 p.m.? Well, maybe, but there are ways to ask it that don't put you back on the defensive,
Yes.
which is fine. And I think, again, as an interviewer, I would be concerned if somebody didn't bring up those questions, because, and sometimes I will just offer it right up, because those are things that really should be brought up during these discussions. There should be no surprises.
Yes.
The other thing that I think is important is, especially as you're talking to or giving advice to some of the anesthesia providers that are coming out of training or looking for the first job or things of that nature, is it's okay to ask what your expectations will be, meaning, am I going to be doing hearts? Am I going to be doing peds? Am I going to be doing a lot of nerve blocks? Or am I going to be off-site in scenarios where I'm very isolated and solo. In our group case, am I going to be at a center by myself? Yes. And for that reason, we've had a lot of interest from younger anesthesia providers coming out of residency or fellowship, or even 2 or 3 years out. And I used to hate when people said this to me, but because they would say, don't go right into, an all outpatient ASC type practice right out of training, because you're not going to get the experience you need to carry you through your whole career. I'm like, that's can't be true. But my first year out of residency, I left residency. I went 1 year in Houston while my wife was finishing her residency there, and joined a large group, amazing group of people. I went to a good residency, I thought, and I thought I was prepared to go out there. I called for help for one reason or another. I mean, more times than I would like to admit. Sometimes emergently, hey, I need help with an airway. Sometimes simple stuff like, do you guys normally tube or put an LMA in these type of cases? But having that support system is not underrated. I learned more my first year out in practice, being surrounded by people who are supportive and there physically to help me and lend a hand, than I would have in any other scenario. And is it impossible to come out of training and go right into a setting where that's not happening? Of course, but you want to do yourself the favor also. And again, that's where the honesty comes back through. So I would want to know, am I doing hearts? Am I doing blocks? If I don't feel proficient in nerve blocks, I want to say that. But you also want to, if this is true for you, you want to give the idea that you're open to learning, and as long as there's support there, that you're open to learning, you're excited about it, you want to get better, you have the foundation for it, but be honest as far as where you're at with it. Again, everything we do as a group is when incentives align. And that's, again, one of the reasons why I like outpatient anesthesia so much in the ASC setting, is the one way everybody wins is when everybody wins. When the facility, the surgeon, the patient, and the anesthesia team all do well. So if I'm doing a shoulder surgery and that patient needs an interscaling block and I'm just not comfortable with it, that is bad for the patient. That's bad, looks bad on the group. That's bad for the surgeon and his or her outcome. And it's bad for me as a provider. It puts me in a situation that I don't need to be in. So if I'm looking for a job, I want to find a job that allows me to grow. If I have these certain areas where there may be some weaknesses that can be improved upon, and I have the support to do it, but I also have that comfort level and I can fit in these roles that are needed in, many of the scenarios. And it doesn't have to be every single scenario. You don't have to be the best cardiac, pediatric, regional OB anesthesiologist in the world. And again, that's where the job of the interview process, it really is a two-way street between the interviewer and the interviewee to elicit strengths, weaknesses, and really say whether or not, it's worth continuing these discussions based purely on skill set.
Yes. I want to back up to one thing before I get to what you just said there. I think the art of asking a question is very important. Like you said, there's certain things you do need to find out. And if you just come straight out and very blatant, like, am I going to take call type of deal, it rubs the wrong way. Like you said, you have to sort of frame the question just right to get the answer that you're looking for, but at the same time, not come off as this. It's just all about me type of deal. And then the second thing, we're talking about, what's doing best for the patient, for the surgeon, for yourself. One of the things I always try to tell people early on in the training, anesthesia, you have to kick your ego out the door. I mean, you're coming into this, you don't know anything, you don't know anything at this point in the stage. And guess what? When you're 13, 15, 20 years out in the line, there's still things that you're not going to know, or even things that you forgot. You always have to be humble. mean, I'm constantly asking questions like you were talking about, like put an ET tube in this patient or an LMA, what have you guys done in the past? Just kick that ego outside the door, because it is really then all about the patient.
100%. And that's again where the interviewee can really try to figure out the culture of the group, right? And anesthesia is a team sport, in every facet of the statement. And going into a group, I want to know that I can ask those questions, right? I want to know that I have people to lean on. So definitely very important to know that you have the support system, and that allows you the comfort to ask the questions. We have, as a group, we are constantly texting back and forth, calling each other, double checking. And again, that's because we all succeed or fail with each other. So, this is not an individual, approach to medicine here. Anesthesia is pretty unique, that you're as good as your weakest link, and we all are there. If every one of us says we are there to give the patient the best experience, then indirectly you're doing what's best for the group as well. So you want to be a part of a supportive group. This sort of every man for themselves, every woman for themselves mentality is very dangerous in anesthesia, both for you, the group, and the patients. So that's hard to elicit from an interview. That's where if I'm going into a group and trying to figure out if I'm a good fit or not, it's okay to ask for as many references as possible within the group. Younger guys, older guys, people who maybe have even left the group, whatever it is. It's okay to ask for that, and it's okay to have those conversations with those people within the group. I think it's super important.
Absolutely. Well, I appreciate everything you shared with us today. I don't want to keep you on all night because I know we talked for hours on end, but before we get off, can you please plug Adaptrack for us? Just tell us a little bit what that is all about. Here's your chance. Go for it.
Yeah, but we weren't going to talk for hours,
I got another 12-hour shift tomorrow. For 14 hours. We'll see what happens. Yeah.
So, yeah, Adaptrack really came about, at least my interest in it, because while I was starting the anesthesia group, I was also working with a medical malpractice company, and started noticing that these risks and medical malpractice claims and trends that happen are predictable. If as I was working with a medical malpractice company from an anesthesia point of view, I was constantly seeing the same issues arise that were leading to medical malpractice claims. Now, if you spread that across all specialties, and you spread that even beyond actual medical malpractice and just look at risks, practice risks in general, there's historical data that really lends itself to show which habits, behaviors, demographics, actions lead to risky scenarios and risky outcomes. I got lucky enough to cross paths with a brilliant tech engineer and business mind, and behavioral scientist, and cross paths with a guy who'd worked for years in the healthcare industry. And the three of us sort of put all of that together and created Adaptrack. So the premise behind it is really, without me coming right out and saying it, we're trying to change habits, and we're trying to change practice behaviors, but we're trying to do it in a very clinician-friendly way, because you and I both know the last thing we want is one more thing to do. But the fact is, we're already doing a lot of things. We're already having a lot of learning moments. So what we try to do is we try to meet you there where you're already having these moments, and we present these short nudges to you, which are literally 20, 30-second pieces of information. And that information, I'm not going to tell you what to do, but I'm going to tell you a fact. And that fact is going to make you more aware of something. And that awareness over time is going to drive your behavior in a less risky way. And, you know, that's great to say, but, you know, again, we are all very incentive driven. So in order to really complete that learning loop, we had to start attaching incentives to this process. That incentive became CME credits. So Adaptrack quickly became really the fastest, least expensive way to earn CME credits in a very user-friendly way, with built kind of from the clinician point of view. You know, since then we've really found different unique ways to meet clinicians where they are. You could be taking a walk in nature, you know, and set up to get your text message to reflect on what does that walk in nature do to help drive work-life balance. Well, work-life balance, we know, drives down, you know, physician burnout, clinician burnout, and decreasing burnout, it's really going to reduce your risk of getting sued because you're less likely to make mistakes. And all these things really tie together. And if you can reflect on that, you know, in one sentence, 2 sentences, that active learning is generating your CME credits. So we've been having a lot of fun essentially attaching CME to all of these experiences that we as clinicians are already doing, with the goal of freeing up time so we can do what we're supposed to be doing, which is really taking care of patients, and just as important, taking care of ourselves, which I think we've all learned is just as important over the past year and a half.
Oh, absolutely. And for everybody out there listening, if you haven't checked out Adaptrack yet, it's free to try. You can go through, check all these nudges. I highly recommend it. It's a lot of fun. It's easy to do, and you just pay for your CME credits at the very end. So why not take it for a test drive? So that's it at adaptrack.com. Easy to find. So Brian, thank you very much. Really appreciate, you know, coming on with us tonight, and I look forward to seeing you in the future.
Sounds great. Thank you.
All right, everybody take care and have a great night. Bye.